When a patient presents with uninvestigated dyspepsia, the guidelines suggest that the first step in the management should be testing for H. pylori with a test of active infection, such as the urea breath test or the H. pylori stool antigen test. This is not always done in clinical practice, and what sometimes happens instead is that the patient is referred for endoscopy. Or in other instances, the patient may be prescribed a PPI. And the reason it's important to test for H. pylori before these things are done is that with respect to endoscopy, endoscopy is typically reserved for patients who are at higher risk for underlying gastric cancer. When someone is under the age of 60, and if they do not have the so-called alarm signs of weight loss, dysphagia, early satiety, vomiting, those individuals are highly unlikely to have underlying gastric cancer. So performing an upper endoscopy on them before performing a non-invasive test for H. pylori is really taking a very invasive procedure and subjecting them to that when the answer may be that they have a treatable bacterial infection that can be diagnosed non-invasively.